Hi everyone, a very good afternoon to all of you. I am Dr. Amit Mittal. I am a senior intervention cardiologist at Indraprastha Apollo Hospital, New Delhi. I welcome you all to this session of cardiac disease and hypertension. So, I'm here to answer all your queries about the blood pressure, about the cardiac disease. Whatever query you have, I'll try to answer them as brief as possible. So, we can start with the queries. So we have a query that I have IBS problem. IBS, I suppose it's a irritable bowel syndrome you are asking about, Shahid. So irritable bowel syndrome is basically a gastrointestinal problem, not a cardiac problem. So it's better if a gastroenterologist you can consult with. Otherwise, IBS, what my understanding is, it's irritation of the bowel, and it's a neurological problem, and we have to take some regular medication for the irritable bowel. So it's better for the IBS problem if you can consult a gastroenterologist rather than a cardiologist. Vishal, you are asking about what are the stages of hypertension. Hypertension we stage according to the level of the blood pressure. Below 130 by 90, it's a normal blood pressure. Till 149 by 95, it's the stage 1. From 150 to 170 systolic, and till 100 diastolic, it's the stage 2 hypertension. Beyond that, it's the stage 3 hypertension. According to the stages of the hypertension, we generally give the treatment like if the patient is having a borderline blood pressure of like 144 by 92, generally we ask them to go for the lifestyle changes only for some time. And if those are not controlled on the lifestyle changes for at least a month or so, like reducing the salt in the diet, taking some daily walk, reducing your weight, and if those are not controlled with these lifestyle changes, then we go on to the blood pressure medication. But if the patient present in stage 2, that is the blood pressure more than 150 by 95 diastolic, 150 systolic means the upper one is more than 150 and the lower one is more than 95, then definitely a medication should be started in the initial phase only. And most of the patients of the blood pressure more than 150 by 95 are generally not controlled on a single dose of antihypertensive. They might require more than one pill per day to control the blood pressure. Again, Shahid, I suggest you to meet a gastroenterologist for the IBS problem. But what my colleagues here in Apollo generally give for the IBS problem is the normaxin, some I think a Ganaton, and Colspa tablet. What exactly those medicines, those pills contain, it's better to consult a gastroenterologist. So, Muskan, there is no stroke level blood pressure. Blood pressure, even at the level of 150 by 90, can cause a stroke. Blood pressure at a level of 140 by 90 can cause a stroke. Blood pressure at a level of 200 by 150, 200 by 100 can cause a stroke. Strokes are generally of two types. It's either a ischemic stroke because of the clot formation, or it's a bleeding or hemorrhagic stroke. Hemorrhagic strokes do have a linkage with the blood pressure. Like if the blood pressure is more than 100 and 210 by 110, those patients generally have a tendency to have a hemorrhagic stroke. But also in those patients, the chances of having a ischemic stroke or the clot formation generally increases with the blood pressure. So in any patients, if we see a blood pressure more than 200 by 110, those patients generally have a chances of a stroke much more than vice versa a patient who is having a blood pressure of 140 by 90 or less. So, Avijit, you are asking about the cure of hypertension. Hypertension or blood pressure is categorized into two forms. One is the primary hypertension, another is the secondary hypertension. Primary hypertension didn't have any cause to it. It can be because of your genetics, or it can be because you are first time experiencing in your 30s and 40s blood pressure. This is the primary hypertension in which there is no cause. We cannot cure that hypertension. We can only control the primary hypertension. Other is the secondary hypertension in which there is a cause. The cause can be in form of some renal disease, renal artery stenosis means there is some blockage in the renal artery. It can be coarctation of aorta or some blockage in the main vessel, that is the aorta. It can be some hormonal problems like thyroid problems or pheochromocytoma. Those secondary causes of the blood pressure are curable. But these secondary causes of blood pressure are generally found in age less than, if we found a blood pressure patient in age less than 20, or if the blood pressure is in the age more than 60 years, then only we generally try to cure the blood pressure. So these are the patients in which the blood pressure can be cured if the patient is having a secondary cause of the blood pressure. So what is the treatment of high blood pressure? High blood pressure treatment. High blood pressure treatment, it depends upon the level of blood pressure. If it's a borderline high blood pressure, like I have told you, 144 by 92, that can be treated very well with the lifestyle modifications. So if the blood pressure is more than like 150 by 90, those generally require some form of medical treatment. Medical treatment, uh, if the blood pressure is more than 150 by 90, the mainstay of the treatments are the calcium channel blockers like amlodipine, cilnidipine, benidipine, or those can be ARBs or ACE inhibitors like the telmisartan, olmesartan, losartan. And third is the diuretics. Beta blockers are now no longer the treatment of high blood pressure. Those are not no longer the first line treatments of the high blood pressure. And mind it, if the blood pressure is in the range of 150 by 100 or so, those patients generally require more than one blood pressure medication to control the high blood pressure. Other than the lifestyle changes, we have to reduce the salt, daily walk. If you are a blood pressure patient, how often should I check my blood pressure? If you are not a blood pressure patient, then occasionally, maybe 15 days or 1 month, you can check your blood pressure. If you are a blood pressure patient, then definitely during the initial phase when you are diagnosed for the first time, frequent checking of the blood pressure is required to monitor your blood pressure and to change the blood pressure medication according to your blood pressure. Once the blood pressure medications are regularized, then there is no need of checking it frequently. Maybe in 15 days or 1 month's time, you can check your blood pressure. The best time to check your blood pressure in the day is before meals, that is in the early morning hours before breakfast and before dinner. What dietary choices should I be making for my blood pressure and overall heart health? Okay, so the dietary choices for first of all for the blood pressure is to reduce your salt intake. For a blood pressure patient, we say that 2 grams of salt per day is more than sufficient. That is, half a teaspoon of salt is more than sufficient. Rest of the salt is present in our vegetables, in our fruits only. And other healthy diet is to reduce the oils, especially the oils which solidify in winter should not be taken, like the desi ghee, dalda oil, palm oil, coconut oil. Those are bad for the health. The other oils like the olive oil, canola, the mustard oil, sunflower oil, those are good for the health. And you can take up to 2 teaspoons of those oils per day in your diet. Try to rotate the oils, for a month use mustard oil, for next month use olive oil, for next month canola oil. Try to mix the oils, don't carry on with the single oil throughout the year. And other than that, a daily brisk walk for 30 to 45 minutes. Brisk walking means we should cover 1 kilometer distance in 8 to 10 minutes. That is called a brisk walk. So these are the some healthy habits which we should incorporate in our daily lifestyles. The less use of red meat is another thing that we should incorporate in our diet. More use of the walnuts and the this thing almonds in our diet, some uses of the flax seeds, some uses of the omega-3 fatty acids. These are good things for our heart. The level of exercise, what's recommended for the cardiovascular benefit is like 30 to 45 minutes of brisk walk at least 5 days in a week. Again, I have told you that in a brisk walk, we mean that at least cover the 3 to 4 kilometer in that 30 to 45 minutes interval. Do some stretching or yoga exercises. If you are not going for the brisk walk, then any other cardiovascular exercise like swimming, cycling, jogging, those are good. Treadmill walking we didn't consider very good because it can harm your knees and can in later time can cause osteoarthritis of the knees. So better to walk on some soft surface. That's it.